Good evening. Here we are at the Cottage School, and today the workshop is OT for every child. And I would like to welcome Juana Guglielmino and Isabel and Arielle. You can say your last name. Iwachiw.
That's pretty close.
Oh, good. Okay. And Leva.
Leva, yeah.
All right. And so I'm very happy they were able to come. And perhaps you can say a little bit of what you do, what you're studying.
Yep. So, sure, I'll start. So I'm Laura's daughter, for those who don't know. And I grew up with the school, so I helped with the summer camps, and then I taught here for a little bit. And I went back to school for my master's in occupational therapy. So the three of us are currently second-year students, which is close to our final year before we go out and practice into our fieldwork. And we just wanted to share our love for occupational therapy, or OT, we'll call it OT. But I found OT through children and through just working here and just like the love of play, and that's very much OT, so you'll find out more.
I discovered OT, both my parents are educators in New York City, and I was this was a second career for me. I was an environmental science major in undergrad, and I worked in that field for a little bit, and it wasn't fitting with it was not right. Something was missing. So my parents actually suggested look into occupational therapy because they have OTs at their school, so I looked into it, and here I am.
I, similar to Isabel, it's the second career for me. My undergraduate was in environmental studies, and was kind of all over the place, teaching yoga, working at a natural food store, trying to figure out my way. And when I used to live out west, and when I moved back home, I wanted to pursue graduate school, and wasn't quite sure where I was going to go with that. I was thinking in the environmental world, and then I started working in a psychiatrist's office with clinically depressed patients, and I would be with them 5 days a week for an hour for 6 weeks doing this treatment that they were undergoing called TMS. And I realized, like, I really enjoy this. I really like working with people. I like helping. And so I kind of through that started looking into healthcare and was thinking, how can I marry like my love for the environment and outdoors and nature with healthcare, and I found OT basically through that. And long-winded, my dream would be to be able to bring together connection to nature and the outdoors and integrate that in with children and adults as well. But that's my dream. So.
Welcome to the Cottage School. And I would like to say before we start with OT that when you finish your presentation, Dr. Tony Walsh will talk a little bit about the smart moves. And we had to cancel this workshop, and so we can relate it to what we're talking today.
Sure.
And why don't we go around and introduce ourselves before?
And if you could say just a little bit about why you're interested in this workshop and OT in general.
I am Tony Welsh, and I have 2 kids here at the Cottage School, which is why I am interested in OT, because I have children, and they often, need things that are related to the field of OT, and I also work with a lot of occupational therapists. So
I'm Taylor, and I'm interested in this also as a mom and as a teacher, so it's really applied in both worlds.
I'm Tara, and what interested me was I suspect, although I've never been told by any professionals yet, I suspect that my 4-year-old is a little anxious and has some sensitivities to things that I notice, and maybe that don't like officially qualify her for any label, but I always wonder what we could do to help her more, in all sorts of aspects of, and everything when I consult Google somebody is always talking about somebody's always talking about OT, and OT is for sensory kids or anxious kids or whatever, and so I feel like it just constantly comes back to that. And I'm like, I really need to figure this out and see what this is. So, it just always seems to be mentioned, and quite frankly, just seems like fun. So,
Great.
I think OT is fun.
Yeah.
My name's Elizabeth Knowles. I came here yesterday for a tour because I'm considering sending my son here. And Laura mentioned the workshop. My son has been attending OT for 4 years. And so I've met quite a few occupational therapists. And I really like what they've done as far as helping him with a variety of issues.
That's great.
Hi, my name is Nagina. I'm working here. So of course I'm interested in IT so I can apply to my job. And also the first time when I hear about it, it's when my friend recommended me to use it for my daughter. I have twins and she was a low baby. When she was born she stretched her neck and she was sleeping on one side and I could not deal with it. So we started to do occupational therapy and it was so fun because for her she was like sitting and playing with toys and the doctor was like touching just spots. It was so amazing how she fixed it so quickly.
That's great. My name is Lena. My son comes to the school and I really don't know much about OT. So as Oliver grows up, I'm getting interested and just taking a look at all different aspects of what could help him be a healthier, happier boy.
My name's Kevin. Our daughter Rosie goes here, and I'm here to learn on behalf of myself and my wife more about OT and how we can apply it at home.
I'm Laura. My son also is a student here, and anyone who knows me knows I'm always looking for strategies on how to channel.
I like that word.
I'm trying to be positive about it. Just strategies to help, move him along or deal with certain behaviors. Is that a good way to say it? Okay.
I'm Marilyn. I'm a teacher here, and I want to learn more about OT because I work with kids, and I'd also like to have kids at some point. So, yeah.
And for the audience, if you have any questions, you can type them, and then Marilyn, our tech person here,
I'll
only
reply.
teacher, will respond them.
Yeah.
Let me make sure that everyone can see it. So we're just going to talk a little bit about OT in general, and then go into definitely some strategies, and then open it up for questions, and we're students, but we're going to try to help you as much as possible and give resources, so that's the idea.
So, like most of you, OT, I've expressed, OT's kind of, what is it? What are we doing here? What is this all about? So, occupational therapy, we look at occupations, and that's not jobs. Occupations are tasks and activities that you do to occupy your time. That's where that word comes from. And we all do things in our everyday life, whether we want to, need to, love to. We all do tasks and activities in our lives, some of which are more meaningful than others. And it's those meaningful occupations that we try to target as occupational therapists, because if something is disrupting those occupations, whatever that is for each individual person, our goal is to get in there and try to return that meaning back to the person, whether we're adapting the environment or we're helping them increase their independence in those occupations. That's our goal, is to try to target those things that are meaningful to everyone. So, like preparing a family dinner, that might be meaningful for some people. It might just be, we have to feed the kids tonight. But some people might look at that occupation and think, I love doing this. So let's say you had an injury that prevented you from preparing that meal. So we would work on that injury to help you get back to that meaningful occupation.
And an injury is just sort of a more concrete example, because OT is so broad. It is, and it's very individualized, because again, as Isabel had said, what might be important to you may not be important to someone else. So it's very focused on what you or the individual needs. And as we go through different stages of our life, we have different occupations or activities that we place value on. So if we were to look at a child, coming from a child's perspective, which I believe we have a slide on it that'll list it out as well, but children have very different occupations than we have as adults. Their focus is more on, a huge one being play. It's a major occupation for children. Play, activities of daily life, ADLs we call them, which encompasses feeding, dressing, bathing, so working on being able to put their shoes on, get themselves dressed, eat food, using utensils. School, another big occupation for children, and social participation. So as OTs, when we're working with kids, those are really the main areas that we sort of zone in to work on with them, because this is what's going on daily for them in their lives.
And the OT approach is very holistic, so we look at not just the physical body, we look at the cognitive, the emotional aspect, and we really work with the family, and in schools we work with the teachers, so we're not just treating the child, we're really treating the whole system or the whole dynamic. And with OT, because it's so based on the person's meaningful occupations, it's very client-centered or child-centered or family-centered, so it's not about our goals, it's about their goals, and how can we best support, not just in therapy, but for home, because the parents know the child the best, so what can they do at home to continue, to help the child continue to build those skills, so that they can the overall goal is just to participate in these occupations and in anything that is meaningful to them as they develop.
And we strive to, as Juana said, because we're client-centered, child-centered, and it's not about us, it's really focused, it's a team effort. So we're working with the parents, with the teachers, with everyone that's involved in the child's life, to really enhance their participation in their life.
So this workshop really, sometimes even when people know what OT is, or they've heard of a situation where an OT has worked with a child, sometimes the idea is that we only work on fine motor, or like the pencil grip. What is like the ideal pencil grip? Well, that's not only what we do. So we do so many things. So we're not just focusing on handwriting, and we're not just focusing on the sensory system, although it's a lot of what we know and a lot of what we can help with, but the main point is there doesn't need to be a diagnosis, there doesn't need to be a deficit necessarily, because OT is to promote health, and it's also to prevent injury or to prevent illness. And do you want to say anything else?
No, I think it's to promote and enhance wellness and participation in your daily life. So there's no need for, something doesn't necessarily have to be wrong. As our professors always say to us, and I think we all agree, like, we could all use OT. I could always use some help with promoting and enhancing my participation in my daily life.
New Jersey happens to be what's called a direct access state as well, where with some specialties you need a prescription from a doctor. OT, you do not need a prescription from a doctor to seek services. So.
Yeah, and we're not suggesting that you go and find an OT right now, of course. So that's why we wanted to bring in strategies, because even if a child receives OT services, it might be once or twice a week, and then the rest of the time it's the family working and it's the school working on the strategies just to further develop those skills. So we have some examples. So at ADL, so activities of daily living like dressing and toileting and feeding, sleep, play, education, these are all huge occupations for children. So we're really we focus on seeing is there an issue in participating in one of these or some of these occupations? And we kind of analyze as we assess and evaluate where is that issue, or where can we best support the child and the family. And transitions part.
No, that's the easiest one, I think.
What?
No, I'm just kidding. You can spend your whole life studying transitions, right? I think that's the most difficult part for any parent and any teacher, I would say, with a child, handling a child or a group of children.
Yes.
The transitions, right?
Yeah, and
From activity to activity, bedtime routines, morning routines to get everyone up in the morning. There's a lot of changes that happen. You're getting up, then you're brushing you're eating breakfast. All of those are all transitions that we as occupational therapists can help make that easier for the family.
yeah, and so we have some. These actually come straight from the Association for Occupational Therapy, and they're actually establishing morning routines for children, establishing bedtime routines. Transitions in general, like bath time transitions, mealtime transitions. So we have a couple of copies, but we can also attach it with the PowerPoint so that you have these resources, and we'll touch upon some of them.
And we can send it by email, right?
Yeah, because we found these were really helpful.
We were actually talking about routines on Monday. We did a positive discipline workshop, and we were talking about the routine charts. So it's great. I didn't know you were going to include it, but I know you have it now because I saw the PowerPoint. Which is great.
Yeah, we have a lot of tactics specifically for transitions, because that is a major, an area that a lot of children sometimes have struggles with. Another area that we can work on as OTs are picky eaters. I know, like, a lot of kids, they don't want to try new foods, or they can be very picky and finicky, whether it be like because of a sensory issue or an oral motor thing going on, and we have, again, strategies to work with that. So we're going to go over some of these strategies. We have some resources for you, and
Do you have any questions? So, some home strategies. Now, we're working with children, so we want to make it fun. So those two pictures on the right are routine, like picture schedules that can be used as a strategy to help your child with routines. The time for sleep, this is something that we call like a sleep hygiene strategy, where you do similar things every night that get the child into that sleep system. We're calming them down, we're doing the same things every night to help them establish those habits and routines that could make sleep time a little bit easier to get into for a child. So like I said, like predictable routines are things that some kids are very good with following. That consistency really helps them. Environmental adaptations, as OTs, we're also looking at environmental adaptations. How can we make the environment more suitable for more success? So these are things like quieting the room, making it dark, having a comfortable bedroom, limiting what we call blue lights, like tablets, close to, a lot of kids I know these days are using a lot of tablets and blue lights, and that can like stimulate the sensory system too much, especially towards bedtime. So we try to ask parents, like, limit that, and that will hopefully help,
And ways that you can do this are like what we're saying. Strategies are using things like picture charts or having the different types of schedules, which are very beneficial, because although kids respond well to routine, sometimes you need different cues to help them to get used to that routine, as opposed to just saying it to them every night. So using different, like, there are so many of these, you can find these very easily on, like, do a quick Google search, and having them around, so you have different visual cues and aids to use are very helpful. Other things that you can use to go hand in hand with these, with the visual cues, are things like having timers, because kids, you know, concept of time is, they don't really grasp that yet. So we have
a visual timer.
That's fantastic. It's the first time I see it.
yeah.
and we also go
We're
into
talking
Because when you say to a kid, okay, 10 minutes left, what does that mean?
Yeah.
So and then turn it on, and then eventually when they see how it moves, so it's making the time concrete.
Where do you get that?
No, this is the first time I see. I mean, timers I've seen, but this one.
Yeah, it's actually, well, I was just searching for a picture of it. They have them on Amazon.
It's not that we're doing
that
advertising.
expensive. Yeah, but, and then they'll, well, it should sound, but.
I've seen apps that do the
Really?
same thing. Yeah.
With the colors.
Yeah, and it's similar.
Because that was one of the questions on Monday during the workshop of positive discipline. Okay, you have all this chart, but it could take forever to finish, right? So you need the timer, but actually with colors it's fantastic.
Yeah.
And their
Because some
their
kids-
masters are extending the time.
Right, yeah.
Let's stay in that picture.
It's so interesting. Like when the other day I gave it a shot, I turned the app on and I didn't need to tell her. She didn't feel like arguing with the timer.
That's right. That's the
And I
other
was
point. Yes.
It's very interesting.
So you put the power
It just
on the
made sense
timer.
to her.
Yeah, so
She
you're not the
just-
boss
yeah, I
anymore.
I looked over, she was packing.
No, it's true. That's the other
was-
thing. They feel that you're not the boss anymore. That the timer is responsible for
think
whatever she has to
assumed
do.
I was totally out of the. It was her thing.
If I suggest using a timer with my kids, they break down into tears. They're so sad about it.
Oh. So it doesn't work for
It
everyone.
doesn't work for us.
This could have absolutely been a beginner's luck kind of thing, a one-shot deal.
What about a colorful timer?
It's like too stressful for them. They get so stressed out.
I would do that to me.
Yeah. Because
we
they
haven't
know,
tried
like
so
they're
much
such a rule
yet.
follower, especially
Yeah.
my older
Not
one is
yet.
such a
Yes.
rule follower.
Yeah.
So she's so afraid she's not going to finish in the time, and then that would be like so
Oh, I
upsetting
see.
for her.
Okay. So yeah, I guess it
Yeah.
would depend on like what it was
But I re-
for
it
probably
is a
too.
really-
Yeah.
But then
That's
maybe
pretty
she
cool.
would like the schedule, because the schedule's like under her control, you know, within the
She's
time.
got the schedule's
Yeah.
good. We're good with the
Yeah.
schedule.
Yeah.
She'll make the schedule. No, and most of the time we don't have an issue with the timer. It's more like, so when I've suggested using it, it's usually with cleaning up. When I let them know it's time to clean up, they'll go in their room to clean up, and then they find themselves playing, and then their toys are cleaning up the other toys. The whole process is so much longer than it needs to be.
That's so cute. So another suggestion for the routine chart is to take pictures of your kids doing the activity, like brushing their teeth, and then using that for the chart.
Yeah.
We gave
And-
that suggestion on Monday. I
and-
think it's fantastic, right? Because you
Yeah.
have really.
Yeah.
That's great.
And they can be the
Chickens.
ones that check it off or color in the box when it's done, so that they're engaged in that task as well. That it's not just mom and dad are setting the expectations and they're controlling the whole situation. You know,
Right.
that they have some control in this as
Yeah.
well.
Yeah,
And they can
that's-
participate in making it too.
Yeah.
Yes, that's very important.
It's
too.
involved.
And then you're working on some underlying skills as well, like
Yeah.
that fine motor that
Yeah.
we do still work on,
Yes.
but it's not the emphasis of OTs and children. So
Yeah, so then the morning routines, the bedtime routine will definitely influence the morning routine. So, and then sleep, just the quality of sleep in general will influence that. So, creating that routine and that habit at night will hopefully lead to a smoother morning. But just setting those expectations, or for example, planning ahead. I still do this. I did this when I was little, and I still take a long time in the morning.
We
But
had to do it actually at night.
yeah,
choosing
so
clothes.
choosing my
Yes.
clothing, preparing my
I would
lunch.
take
you
the
know.
whole morning to try all of the dresses, high heel shoes.
Don't do that now.
Very coquettish.
marijuana.
We could spend the entire morning.
Yes. So, but
It's an
even
important
just
decision.
So actually, we got into the routine of you picking the clothes the night before. It
Yeah.
really helped so much.
and just having, now I have my backpack ready to go, but having their lunch bag just at the door ready to go for the next day, so they know what they're expecting for the next morning, and they know they wake up, they have breakfast or whatever the routine is, they get dressed, and that it's just hopefully smoother.
So it works 25 years, right?
Yeah, and my punctuality is a different story. But
And habits don't change overnight.
right.
Routines don't change overnight. It's something that it needs to be worked on a more consistent basis.
Mm-hmm.
Yeah. Yeah.
It's true. Yes, consistency is what the kids need too.
So then school strategies. So also you could also use picture schedules in school. They start remembering the typical routine of the day, but just to know that when they arrive, they put on their slippers, here at school, and then they have to be ready for circle time. So even like a picture of circle time, where what does it look like to be ready for circle time? Sitting and ready to learn. So just setting those expectations.
It's a good idea for the playgroup for the kids that just start, the little ones.
Yes, so that they can, because it's so
For sure, we
new.
can suggest that to the parents when they first start, right?
And a lot of these strategies that are listed here for school strategies are also obviously strategies that can be carried over and used at home as well, very easily. Like the idea of saying the first then. We talk a lot about, we want to give the child some control of their own, and in making their own decisions and having control of what they're doing. So there are some things though that have to happen, whether that be like brushing your teeth before going to bed, or something in school, like, we need to put things away and then we can do something else. So giving them, we like to ask them, like, if there's something that they're interested in doing, or if we know that they really want to play with the blocks or something like that, then it's using that first then strategy. Well, first we have to do this, and then we get to do that. And so letting them know that, like, if we can follow this direction, then you get this to have a little bit more control on what you want to do. And that kind of goes with, like, it's a little similar with scheduling free play or for last. It's similar to that, where if there's a bunch of things that have to be done or that they need to do, and we ask them, well, what's the one thing that you want to do, or what are you, if you can pick one thing, what would you like that to be? Then it's all the first we have to do all these things, and then after that you get to do this. This is it's not like necessarily reward, but it's letting them know it's a motivating factor for them.
And it's similar to the positive discipline concept of when you finish copying, then you may draw. It's like that idea, because it's the opposite would be like, what is it?
If you don't do this, then you're not going to go.
Right, but this turns it into positive. So when you do this, and it's just expected. When you finish your work, then you may draw, or then you may play with the blocks, like the little blocks that are over there.
We tell them here they have to finish the activity before they move into the next one.
Yeah.
Whichever activity is.
Apparently these are very popular.
Oh, they're very popular. So like when I used to teach math, and we would count with them or add with them, they just wanted to play. So I would say, or now I would know that I should say, well, first we're gonna add, or we're gonna count, and then when we're done, well, you can play with the blocks, you can make your towers and everything. So that, because it was going to happen, but just letting them know that it was going to happen helped them. So
Setting expectations.
I was gonna say, sometimes I'm sure part of it is like, oh, well, they know they're going to be able to, instead of not at all.
Right.
So
Right.
for a
No,
little
you
kid,
can't
when
do
you
this.
say, like,
Right.
they think, I'm never going to be able to do that ever again.
Yeah.
And they
Like,
know
no, we're
it's,
going to.
it's on the
after this.
horizon, it's coming.
Right. That, just knowing, oh, okay, I'm not being told no.
Yeah.
So do you study positive discipline as part of the OT?
Not directly,
But it
no.
is
But it really
based on
aligns.
Adler's
But-
and
yeah.
Baker's. Do you study that or not? The principles of.
Well, we
They
studied-
align, but not specifically.
I mean, because OT is influenced by a lot of different
Psychology.
theories, and coming from psychology, and so they align very well.
And I think because this school uses positive discipline, now learning about OT, this school is like an OT school.
That's what the OT, 17 years ago, the first OT that came to the school, she said, is this an OT school? They just made today felted eggs with a wool, in the water table. And so that's an activity also, sensory activity.
Oh,
yeah.
So we've been doing them forever, so in between that and everything we do actually, because we also teach through play. And so they don't realize they're developing fine motor skills while they're doing it.
That's the beautiful
Imaginative
thing.
play, all of these things are great for just child development in general.
And like you, Tara, right?
Yes.
Yeah, you had mentioned that it always looked like they were having fun when they were in OT. I mean, that's the point.
Yeah.
Like, we want them to want to come to OT, or we want them to be excited to see the OT, not to be dreading, oh, I have to go to therapy.
Yeah. Every time they were coming, they were like waiting by the door.
Yeah, because it's supposed to be through play, because that is their most important occupation. So it's the most motivating thing to them. And many times, we have a clinic at Kean University, so sometimes I'll see the treatment sessions for the children, and many times they direct it, they lead it. So if they're interested in the bubbles, we're gonna go do bubbles, and then the therapist figures out how to incorporate building the skills in the middle of it. So if they're working on fine motor skills, he will figure it out. But it's very child motivated, child directed.
And providing that like just right challenge for the child to be able to complete the activity without getting too frustrated that they won't be able to, but that they're able to get there, but it's still challenging enough where you're working on the skills all through play.
That's right. It's like they're this great in the school. I didn't know. It's the first time I met them today, actually. Just so you know. But it's great to hear all this.
And we'll go into more movement breaks and really with Tony with the smart moves, because it's so related. But but the idea with movement breaks, it really depends on the energy level of the child. So for some children, they may have low energy, so a movement break might wake them up to be ready for class. Others maybe are not ready to sit down after coming back from the playground. So maybe doing one more movement break of, like, for example, smart move of just touching your knees will help just calm their system down to then be ready to sit down and do the next class.
Snow angels.
Yeah.
Yeah, that's one area that we incorporate a lot in working with children in pediatrics is the sensory system. So no matter what setting you're in, whether you're at a sensory gym, you're in a school, a private clinic, incorporating the sensory system with children is very important, because everyone has different sensory preferences, not just children, all of us. So some of us react, like certain senses heighten us, whether it could be smells or things we hear that maybe it bothers us, or it brings our arousal levels up, or maybe it calms us and brings our arousal level down. So children have that too, and often they have trouble sort of figuring out what is heightening them and what calms them. So we work on there, and there are things that we could probably also, if you were interested, provide you with copies of the sensory profile, which you can fill out for your child because you are with them and you know them, and there are options to have it done, like a parent can fill it out for their child, and it can help you identify their sensory preferences. And so if you understand their sensory preferences, then there are different strategies you can take, whether it be at home or to prepare them for transitions, or going to school, or even knowing this to communicate with their teacher for while they're at school. Things like, we know proprioception, which is deep pressure, yeah. So it's that feeling of getting a big hug, that's proprioceptive input, and we know that proprioception is very calming. Almost in any scenario, it's calming. Whereas the other senses depends very much on the person, like the vestibular system of where your head is in relation to your body in space can be very alerting for individuals. Same with smells and tastes and sounds. But proprioception